Acute schizophrenia. Dear all, today let us discuss the symptoms of acute schizophrenia.
What is schizophrenia? You know, it is a mental syndrome, a severe mental disease having a group of symptoms. It is identified a century ago in the world and had studied the various aspects of this syndrome. All the symptoms of acute schizophrenia is positive and that of chronic is negative. The symptoms were unbelievable, amazing, and frightening.
In acute schizophrenia, the predominant clinical symptoms are hallucinations, delusions, and interference with thinking. Some patients may recover from positive symptoms, whilst others end to chronic.
The clinical features of acute schizophrenia. 1. Auditory hallucinations and delusions. It is the most important symptom. Patients hear their thoughts spoken out loudly by people around them. Auditory hallucinations may take the form of noises, single words, music, brief phrases, or conversations. The schizophrenics hear their own thoughts spoken out loudly with their ear after hours of thinking. It is Gedankenlautwerden. The schizophrenics hear their own thoughts spoken out loudly with their ear immediately afterwards of their thinking. It is echo de la pensée. The matter of auditory hallucinations of thought spoken out related to persecutory, contemptuous, matter of having make fun of, maybe praising, commending the identity, the status, and so on.
Appearance and behavior. In acute schizophrenia, the appearance and behavior of patients are normal, but some patients are preoccupied and odd. Some are restless and noisy. Some show unexpected changes in their behavior.
Abnormalities of mood. Common abnormalities of mood are anxiety, depression, euphoria, flattening of affect, and incongruity of affect. The speech. It often reflects the thought disorder. Some patients have concrete thinking, while other patients preoccupied with pseudoscientific or mystical ideas. Loosening of association. The structure and coherence of thinking is lost, and so the utterances were jumbled. Some of them use ordinary words in unusual ways and coin new words. Tactile, gustatory, olfactory, and somatic hallucinations will also have to some patients. Rarely, visual hallucinations also there. 2. Lack of insight. The patient have no insight. He don't know whether he have any mental illness or not, since the patient have no pain or any pathological symptom. Next symptom. 3. Ideas of reference. 4. Suspiciousness. 5. Voices speaking to the patient. 6. Delusions of persecution. And 7. Delusional modes. Note: in acute schizophrenia, the patient who will not necessarily experience all these symptoms. Normal to patients. Orientation of the patient is normal. Memory have no impairment. Poor to patients. Attention, concentration, and insight were very poor. How to recover from auditory hallucinations and delusions? The most important and dangerous symptom of acute schizophrenia. Gaining of insight is the key point and very necessary for the recovery and release from auditory hallucination than medication. The patient believes that everything he hears is real because he hears it with his ears. The patient still hears it like he heard it before he got schizophrenia. How can you believe that what is being heard is what is not being said? The patient does not know what he hears being spoken is what is thought in his mind, but not what is actually being said. Then how will get insight? Only two remedies. 1. Either someone should tell to him the symptoms of schizophrenia, or the patient should read about schizophrenia during his suffering. Should be very careful when you say this to the patient. It should be said without hurting the pride, and only those who are very close and loved should say this to the patient. The patient got insight. From the moment of knowing this, the patient will understand that he is suffering from a mental disease, and slowly the patient will recover completely from auditory hallucinations and delusions and not enter to chronic. His brain was his enemy. How can the schizophrenics distinguish between what people actually say and what they hear through hallucination? But this is based on some factors. This is something to be realized with the intellect of the patient. A. Don't believe the words that are not directly said by looking at the face. B. You must control your head. C. It should be thought that the speech, that is auditory hallucination, is conducting between the left and the right side of the head and not actually happening around. D. You, that is a patient, tell to your head, that is in mind, that you don't want any lies with me. E. Even after insight, whenever you heard conversation, you tell in mind to your head, don't try to fool me. Believe only what others told to patients directly. Don't trust overhearing. That may be hallucination. This trust is being possible only to intellectual patients. Suppose your brain is a magic brain, and it is this brain which make conversations and persecutory talks without your knowledge and not others. You may believe the occurrence of natural sounds like raining, thunder, motor vehicles, singing of birds, barking of dogs, etc.
The structure of the brain will not change after getting insight.
Precautionary measures. Precautionary measures may help for getting future insight. The schizophrenics should tell to their teenage children that you may develop a mental condition called schizophrenia in future. They should know the symptoms. Etiology. 1. Hereditary cause. If one parent is schizophrenic, then their children have 14% expectancy for schizophrenia development.
If both parents is schizophrenics, then their children have 37 to 45% expectancy of schizophrenia development.
2. Perinatal complications. 3. Virus disease of the brain in early life. 4. Possibility for schizophrenia for those who have left hemisphere dysfunction. 5. Variations of dopamine in brain. There is many other possible factors also for the development of acute schizophrenia. Epidemiology. According to WHO, the incidence and prevalence of schizophrenia varies across the world. According to data, incidence rate is high in Asian countries like Indonesia and low in Australia.
The average incidence of schizophrenia is 0.32% of world population.
It appears more frequently and earlier in males than females. This is the first and the only video suggesting a technique for the recovery from the auditory hallucination during acute schizophrenia.
I think this video may help millions of acute schizophrenics and their relatives across the world.